Chapter 21, Concluding Reflections. It seems unnecessary to increase the volume of this book. If the successful treatment of very many thousands of cases of a large variety of diseases, including a liberal percentage of so-called incurable ones, does not prove the efficacy of urine therapy, then nothing else can. Moreover, as you have seen, many of the patients had previously tried other methods, both orthodox and unorthodox, without success. This is not to say that the therapy can, without exception, cure every patient of every diseased condition. Severe arthritic conditions have proved very difficult to cure, whilst diabetic conditions have in many cases not yielded to the treatment at all. On the other hand, which may seem strange, growths and tumors said to be cancerous, as also cataracts, have yielded quickly. As for those patients who might have been saved by urine therapy, they probably run into large figures. These are chiefly cases I had to decline to help, not because I regarded them as hopeless in themselves, but because I feared the interference of well-meaning but timid relatives at a vital point when such interference might well have proved fatal, and they and I should have been faced with an inquest. In short, I was taking no chances, for only qualified doctors can do this without risk to themselves. In other words, doctors are allowed to experiment on their patients either with drugs or with the knife, and if the patients die, so much the worse for the relatives, whilst the doctor is credited with having done his best with a hopeless case. One may perhaps argue that a layman who has found an efficacious cure for diseases should qualify himself to be an orthodox doctor, at least in name, if not in fact. But how can a man with any pretensions to uprightness bring himself to study a system of medicine in which he does not believe and which he regards as a menace to health? And for what? Merely that he should be able to diagnose and give a number of diseases and call them by polysyllabic names? And supposing, as with urine therapy, the name of the disease has nothing to do with the selection of the treatment, what then? Indeed, the necessity for a correct diagnosis before a line of treatment can be decided upon is one of the drawbacks and limitations of allopathy. For example, if a woman has a growth in her breast, the first thing a doctor wants to determine is whether it is malignant or benign. But with urine therapy, such a question is not of the least importance, since, as we have witnessed, the treatment for all diseases is virtually the same procedure, seeing that in the patient lies the magic fluid, underquotes, to cure his or her ills, and the only prerequisite is to refrain from food, like the animals, so as to give nature her chance to do the work. And she will do it in her own way, provided she is not interfered with. This I have observed again and again with regard to the movement of the bowels during the urine fast plus plain cold water, whereas the orthodox, underquotes, naturopath thinks it necessary to assist the bowels with enemata during a fast on cold water alone or on fruit juices, a mistaken policy. On no account should such measures be resorted to during a urine fast, for nature must be left to determine when the bowels shall move. What we have to remember is that in fasting, urine taken via the mouth heals, rebuilds, and reconditions the vital organs, including the intestines, and while this process is taking place, often the bowels seem, as it were, to go to sleep and relapse into a state of inactivity, which in severe cases may even last as long as 19 days. Yet this inactivity is an advantage, especially to sufferers from hemorrhoids, as it gives the latter a chance to heal. Thus, nature, if left alone, does her work in her own way if we only have the faith to trust her, even though at first we may not understand her mysteries. Verily, nature's ways are not our ways, and she defies and contradicts every superstition and orthodox tenet, practice, and belief.